Hi, welcome to Professional Certifications channel. Let's break down RHIA exam preparation, one topic a day for focused and effective learning. Today's topic is covered entities in healthcare.
1. What is a covered entity? Let's start with the basics. What exactly is a covered entity in the context of healthcare? A covered entity is a term defined by the Health Insurance Portability and Accountability Act, or HIPAA, to describe organizations that must comply with HIPAA's regulations on the protection of patient health information. Covered entities are primarily responsible for safeguarding protected health information, or PHI, and ensuring that it is used and disclosed in accordance with HIPAA rules. There are three main types of covered entities under HIPAA: healthcare providers, health plans, and healthcare clearinghouses. Each of these entities has specific obligations under HIPAA to protect patient data and ensure privacy.
2. Types of covered entities. Now that we know what a covered entity is, let's break down the three main types of covered entities and what they do. 1. Healthcare providers. The first type of covered entity is healthcare providers. This includes doctors, hospitals, clinics, dentists, psychologists, pharmacies, and any other healthcare organization that transmits health information electronically in connection with transactions for which the U.S. Department of Health and Human Services, HHS, has adopted standards. Essentially, if a healthcare provider uses electronic means to transmit information related to billing, claims, or other healthcare services, they are considered a covered entity. 2. Health plans. The second type of covered entity is health plans. Health plans include insurance companies, HMOs, health maintenance organizations, employer-sponsored health plans, Medicare, Medicaid, and other programs that provide or pay for healthcare. These entities are responsible for ensuring that the health information they handle is protected and used appropriately. 3. Healthcare clearinghouses. The third type of covered entity is healthcare clearinghouses. These are organizations that process non-standard health information they receive from another entity into a standard format, or vice versa. Clearinghouses are often involved in billing, processing claims, and other administrative tasks that require converting data formats. Like healthcare providers and health plans, clearinghouses must also comply with HIPAA regulations to protect PHI.
3. Responsibilities of covered entities under HIPAA. Covered entities have several key responsibilities under HIPAA to ensure that patient health information is protected. Let's go over these responsibilities. 1. Safeguarding PHI. The primary responsibility of covered entities is to safeguard protected health information, PHI. PHI includes any information that can identify a patient and relates to their health status, healthcare services, or payment for healthcare. Covered entities must implement physical, administrative, and technical safeguards to protect this information from unauthorized access, use, or disclosure. 2. Providing notice of privacy practices. Covered entities are required to provide patients with a notice of privacy practices. This document explains how the entity will use and disclose PHI, the patient's rights regarding their health information, and the entity's legal duties to protect PHI. The notice must be provided to patients at the first point of contact and made available upon request.
3. Obtaining patient consent and authorization. In most cases, covered entities must obtain patient consent or authorization before using or disclosing PHI for purposes other than treatment, payment, or healthcare operations. This includes activities such as marketing, research, or sharing information with third parties that are not directly involved in the patient's care.
4. Reporting breaches. If a breach of PHI occurs, covered entities are required to report the breach to the affected individuals, the Department of Health and Human Services, HHS, and, in some cases, the media. Covered entities must also take steps to mitigate the breach and prevent future incidents. Timely reporting and response are crucial to maintaining compliance and protecting patient trust. 5. Ensuring business associate compliance. Covered entities often work with third-party service providers known as business associates, who may have access to PHI. Covered entities must ensure that their business associates also comply with HIPAA regulations by entering into business associate agreements, BAAs. These agreements outline the responsibilities of the business associate in protecting PHI and the consequences of failing to do so.
4. Challenges and best practices for covered entities. While being a covered entity comes with significant responsibilities, it also presents challenges. Let's discuss some common challenges and best practices for maintaining compliance. Keeping up with regulatory changes. Healthcare regulations, including HIPAA, are constantly evolving. Staying up to date with these changes can be challenging, especially for large organizations. Best practices include subscribing to regulatory updates, attending compliance training sessions, and designating a compliance officer to monitor changes and ensure that policies and procedures are updated accordingly. Employee training and awareness. Ensuring that all employees understand their responsibilities under HIPAA is critical for maintaining compliance. Regular training sessions, clear communication about the importance of protecting PHI, and ongoing awareness campaigns can help reinforce the importance of confidentiality and security among staff.
Implementing robust security measures. Covered entities must implement robust security measures to protect PHI from breaches and unauthorized access. This includes using encryption, access controls, secure communication channels, and regularly updating security protocols. Conducting regular risk assessments and security audits can also help identify potential vulnerabilities and ensure that security measures are effective.
Managing business associates. Working with business associates can complicate compliance efforts. Covered entities must ensure that their business associates understand their responsibilities under HIPAA and adhere to the terms of the Business Associate Agreement. Regularly reviewing and updating these agreements, as well as conducting audits of business associates, can help ensure compliance. Responding to breaches. Despite best efforts, breaches can still occur. Having a clear breach response plan in place is essential for minimizing the impact of a breach. This includes identifying the breach, containing it, notifying affected individuals, and taking steps to prevent future breaches. Regularly testing and updating the breach response plan can help ensure that the organization is prepared to respond effectively.
Conclusion. In conclusion, covered entities play a vital role in protecting patient health information and ensuring compliance with HIPAA regulations. By understanding their responsibilities, staying informed about regulatory changes, and implementing best practices, covered entities can safeguard PHI, maintain patient trust, and avoid legal and financial penalties. Whether you're a healthcare provider, a health plan, or a healthcare clearinghouse, maintaining compliance is essential for the success and integrity of your organization.